Hi all, welcome to the new video. I had done a video with regard to the preparation of curriculum vitae. Fortunately or unfortunately it was in Malayalam and I got a lot of comments that please do it in English as well because we all are from, we are not Malayalis, not from Kerala, can't understand Malayalam as well. So this video is with regard to the preparation of CV, especially for nurses. And before proceeding to this particular preparation of CV, I just wanted to make sure few things. One is it's not mandate that you have to follow the preparation of CV as I am saying. It's just some guidelines, some suggestions only. If you feel that that is good, you can take it with you. If you feel that, or if you feel that only some component of parts which I am discussing is good, which you can take. If you feel that this is not at all good, it's not the right way, you please ignore it. But if you feel that somewhere it is good, please accept it, take it, it will definitely help you. And I have prepared this format not just in one day because I have interacted with a lot of people, lot of nurses, especially those who are in a reputed position. And what is their impression with regard to a nurse when they are hiring a staff in their position. So from the feedback only I have prepared this, and we also helped lot of nurses to prepare CV to go to different foreign countries, especially in United States, Australia, New Zealand, UK, Ireland as well. So I hope that this particular methods to prepare the CV will definitely help you in your future. And one more thing, when we say about the CV, usually there are two types of size are there. One category of people will say CV should be as concise as it is. It should be very minimum, maximum in 2 pages or 1 page. That is a CV. But on the other side, there are certain people they say that no, we want an elaborative CV. We wanted to know you in detail in your profession. What are your achievements, your gains, your competencies, your skills, your educational background. So always it is a tug of war between these two kind of people, and nurses also are in a dilemma that which one to opt. So for me, the concise CV is mainly required for HR personnel, those who are looking into your CV initially. They just want only few information that what is your qualification, how many years of experience you have, where you worked, only that much, or do you have some other additional qualification pertaining to the job role. On the other side, if you are going for one more thing, usually when in a hospital, if you are going to be hired, your CV is finally evaluated by not the HR. It will be by the nursing superintendent or the chief nursing officer or the director of nursing of that hospital. If they wanted to hire you in their department or in their institute or hospital, they wanted to know you in detail. Just periphery knowledge about with regard to your profession is not enough. You should require a detailed CV. So I am also going to present how to prepare a detailed CV. So I hope that you can see the screen also over here, and there are certain people they will write resume, but the appropriate word is curriculum vitae. If you wanted to use resume, that's fine, but the real meaning of resume is it's just a short form of CV. The curriculum vitae says it's a detailed presentation about yourself, and again it's a sample format. It's up to you whether to take it or not. And before proceeding, one more thing. It was a concept that when you start writing your CV, you used to write all your personal details. That was the practice, but it is not required. So what I had given over here is your name, email address and mobile number. When you write your mobile number, please put your country code. If you are an Indian, you can always write 0091. So that is the country code of India. And name, write your full name and email ID. And email ID, when you choose an email ID, maybe you already have an email ID, it's up to you which name you have to select, but always try to create an email ID where your name resembles. For example, my name is Jeril Cherian, so and when my email ID is jerilcherian@gmail.com, maybe the time when Gmail was evolved, or I had taken that email ID, so that's what I took the same name. It may not be easy to get the same name of your email ID, but because what I have seen is there are certain people will take email ID with regard to the place. So if your place is too long, if it is Aurangabad or Thiruvananthapuram, it is having lot of characters and you add some of your name, it will be really lengthy one. But it is always better to have a concise email ID. I mean, the character should be less than 10 ideally. Again, it is your choice. You can keep a lengthy one, but make it as short as you can, and try to avoid the flower, animal, all those pet name in your email ID. Again, it's not mandatory, but it is ideal to have something resembles with your name. When you are keeping the mobile number, of course you may have 2 or 3 mobile number, but always try to make only one number as primary, and please try to keep that number as your WhatsApp also, because there are certain people there, usually the calling number is one and WhatsApp number is different. This always makes confusion, and even though the employer wanted to make you do an interview call, they may be trying one number, they may not get it, they may try your second number, or they will just leave it as it is. And there was a habit that we used to write all the addresses and all initially, but you think an era where the technology is evolved this much. Now there is no need to write all the address, because none of your employer is going to send interview call or an appointment letter by post. It's always by email only. So email, this much information is enough in the initial stage. With regard to the address, I will speak later. Coming back to the career objective, that is the next component. So career objective, it is always try to write an objective in your CV where you wanted to become after 1 year or 2 year or 3 year, or what is your ambition. Please don't copy paste of your friends' career objective as yours. You may have some passion towards this profession, or I want to, if for example, if I say I wanted to become a competent nurse in the perioperative setup, nursing setup, or something else, just an example only, but it's always better you choose your own career objective. Why I am saying this again is, you may copy from your friend for some sake, and if you are going to a good institute with your CV, usually the interview board may ask, okay, what is your career objective? And if you don't know, or if you are saying some kind of objective which is not listed over here, then it's not much. Or otherwise you can say that maybe when I prepared the CV, my objective was this, later I changed. But again, think that is not an updated CV, it is an old CV. So try to write the objective clearly, and if you don't know how to write an objective, just ignore this part. No need to keep this, just ignore it. Okay, so the second portion is languages known, and don't write the regional languages of Malayalam, Tamil, Kannada, Urdu, Bengali, or Oriya. All these are not required. Maximum, if you wanted to keep, if you are applying in India, of course, yes, you can keep all these regional languages, it's good. But especially when you are applying to a foreign country, keep foreign languages. Obviously, English has to come first. If you are applying to an English speaking country, okay, and if you know Arabic, you can keep Arabic, you can keep French, Spanish, German. So all these are the different languages usually people may know, or that may be most spoken in the world. Of course, Chinese is most spoken, but I am not pretty sure that you won't go to China for a job. Again, in the score, if it is because majority will opt IELTS or OET, you can again write the 4 modules, that is speaking, writing, reading and listening. So writing, reading and listening. So if you divide all these 4 components and if you write your score over here, so like I got all 7 in IELTS academic. So when you are writing IELTS, also specify it is IELTS academic or IELTS general. Majority of the country they prefer academic. So when you write your score, and if you have additional languages, like if you know French, so like French, and you know only speaking skill, please put a tick. Remaining all, if you doesn't know, just leave it. Okay, I hope it is clear with regard to the language. Next is qualification. In the qualification column, if you are a nurse, you can start from your GNM or BSc, because SSLC plus 2, it's understood that without that you can't do a nursing. Still, if you wanted to write your 10th or plus 2, so you can just write SSLC, don't write, you just type it, or you can write plus 2, and university where you study it, if it is Kerala, you can write that Kerala State Board, whatever it is. Duration, usually if it is 10th, no need to mention also, otherwise it's only 1 year, because it's only that particular year is calculated. Okay, then year of passing, if it is you passed in something millennium 2000, just put 2000. And it is a habit that there are certain people, you will keep the percentage of your mark. It's a good habit, and comparatively nowadays children are getting very good score, because especially in 10th you may get 100% of score. If you wanted to keep, you keep it, but make sure one thing, when you write the percentage of the mark, it's good that if you wanted to present your percentage, you keep it. Nowadays majority of you are getting 100% in SSLC. It's good you keep it, but you have to be aware of one more thing. For example, plus 2, you may got again 95%, well and good, where you have done your BSc nursing, and BSc nursing, okay, your mark is something 60%. It is better, don't keep. That means you have to ignore all these 3, because initially your percentage of mark was very high, then when it came to nursing, it's only 60%. That is something, it's not good to present, because it shows that academically you are going down. But on the other side, if you have something 70% or more than 70% in a professional course, very well you can keep it. It doesn't mean that you are academically going down, because in the professional colleges it's very difficult to get a score above 90%. Anything 70% is good, very good. Anything 80% is excellent in a professional course. I hope it is clear, so you can keep that also. And the university or board, suppose you are BSc nursing, I am not mentioning any college, but if you studied in a very reputed colleges, one of the college in India or abroad, you write the college name. Or if you feel that your college was not so famous, just write the name of the university, it is well and good. No need to mention your college. Again, I don't want to degrade any college, but just I am commonly saying. So if you are again in a premier college, write the name, and you are going to decide whether you studied in a premium college or a college which is just ordinary. I hope it's clear about this qualification. Okay, of course, if you have done your PCBC or MSc, that also you can be added very well. Next is additional qualification. So any qualification which you have done after your professional degree is considered in the additional qualification. So it may be a university course, or it may be maybe a 1-day course, or 3 days, or 1 week, 1 month, 6 months, or 1 year. Any such program can be entered over here, and that is really calculated by your employer, because it shows consistency in your academics. You are interested in learning. So if you have a ambition, or if you have a passion towards learning, it shows that you will be a very good academician, or you will be a very good clinician or clinical nurse in that particular institute. Those kind of attitude will definitely make you easy to pass through the interview process. Like for example, if you have done an infection control course for 5 days or 2 days, 3 days, very well you can mention it over there. Or you have done some course with regard to quality, or you have done some course with regard to IV therapy or pain management. So it is an extensive program. So if you are attended some course for 1 hour, 2 hour, that is this is not the place to write. I will give an option for that. It will go to the CNE or professional development programs. So that has to be written separately, not over here. And when you are writing, always write the latest one first, which you attended. Professional experience. Now you may have experience either in India or in an abroad country. If you have overseas experience apart from India, then when you are writing the name of the hospital, please mention the country also. like you worked in Kuwait or Bahrain or Qatar, UAE. So all these you can mention with the name of the hospital and department, which department you are working in. For example, you are in OPD or medical surgical ward, ICU. ICU again, you have a lot of ICU like MICU, SICU, NICU, surgical ICU or CCU, special baby care unit, neuro ICU, neurosurgical ICU. N number of ICUs are there, so please write it completely, because for example, if you are writing NICU, it may be neonatal intensive care unit or neurosurgical or neurology. So there may be misinterpretation may happen. So please write it, try to write it completely, because to avoid all these confusions. And duration which you what, and you can write one more thing, what was your position held over there, was it as a staff nurse or was it a charge nurse or supervisor or any other post you have taken during those period, that also you can mention it. If you are not mentioning also, not a problem, but it's up to you. Now accreditation, if your hospital is accredited either by ISO, Joint Commission or NABH, please mention it over there. And along with that, you can also mention the bed number. Maybe I worked in a hospital that is having a bed capacity of 1500 or 750 or 200 or 100 bedded capacity. So whatever it is, but it shows that suppose if it is anything which is over 400 or is considered as a super hospital, because as the number of bed capacity increases, the different department will be there, and you also have worked collaboratively with different departments. So it shows that you are more potential or more capacity or more competent. So I hope that is, and again, when you write your professional experience, write the latest one on top, then go down. And no need to separately mention what was the gap in your experience. Just ignore it. You may have some, negatives, lack of experience or gaps. Why you wanted to publish it into a person who doesn't know or not going in detail in your CV? So just ignore, no need to mention your gaps. If they are asking, okay, of course you can mention, otherwise just ignore the part. And duration, anything less than 6 months, better not to mention. And if you also worked in 1 year, 2 hospital or 3 hospital, please don't show, unless otherwise it was, you got a position hike, then you can mention, because you can say that because I got a career growth, I moved from this hospital to another hospital. Otherwise, if you are jumping from one hospital, suppose like for example, you have total 4 years of experience and you worked in 6 hospitals. So that means it shows that you are not a consistent staff. None of the employer will be happy to absorb you. So try to maintain you, and it also shows one thing. So everyone knows that working in a hospital as a staff nurse is a difficult scenario. Even though in that difficult scenario, you try to be in that hospital for 2 years or 3 years, shows that you are consistent, you are ready to take challenges. It gives lot of messages to the other employer. So maintain consistency in your employment, which very well you can mention it in the duration. For example, wherever I worked, I got initially it was 2 years, then for me it is 7 year or 8 year. It goes in that way. So even if I go to one institute to another, I can really say that I am a consistent staff because I worked in this institute for this many years. Even though I come to your institute, I will be there. So the employer will be happy enough to absorb you. So less than 6 months, jumping tendency, none of the employer will be happy with you. Duties and responsibilities. So just don't write from whatever you know just type it. But if you can make it just assessment, planning, implementation, evaluation. I know that this is the nursing process. If you can categorize your duties and responsibilities with this step, your CV looks excellent. And one more thing, if you have held more than one position, write your duties and responsibilities or job description separately, because if you are working as a staff nurse, your duties and responsibilities will be different. If you work as a charge nurse, again it differ. If you are a supervisor, again it differ. If you are a nursing superintendent, again your duties and responsibilities will be totally different. So if you have multiple positions, write duties and responsibilities separately. You may wonder that your CV may go in lot of pages. Doesn't matter. It's about you. Presenting yourself in a very good manner is always embraced by a good employer. Okay. Next, cases handled. So this again you have to be very careful about writing the cases handled. I'll just give an example of if you are working in emergency department, the accident and emergency department. I will just write in a short form A&D. Okay, so this a nurse who worked over here, you might have taken care of lot of patients. For example, you might have managed lot of pediatric patients. You might have managed lot of patients with cardiac problems. You may have respiratory, renal, ortho, neuro. It goes in different segment. So, or for example, in cardiac, so you can mention that each department, and in cardiac again you can underline you managed MI, you managed angina, you managed congestive heart failure, and it goes on in that way. Or for respiratory, you managed pneumonia, you were able to manage asthma or COPD, and there are different things. Again, if it is ortho, polytrauma, head injury, again it's mix of ortho and neuro, fracture, so sprains, strains, it's n number. If it is general case, you can say liver cirrhosis or hernia, strangulation, appendicitis, pancreatitis again. So all these you can list down, because it shows that you are a person who can able to manage this many cases. You got variety of experience. Or I may say one example of one more area, like for example take an example of operation theatre. So what are the departments that you have worked in? You worked in ENT, ophthalm, genitourinary, obstetrics and gynecology, plastic, orthopedic, neuro, cardiothoracic, vascular, nephrology, it goes renal. So it goes in different sectors, and in each department, what are the cases that you managed? In that, what are the cases that you are able to scrub, you are able to circulate? You can write it separately, because again it goes in pages, doesn't matter, again it's about you. So show maximum you can about yourself, and when you are showcasing yourself, don't write anything which you don't know, because definitely when you write something, the employer may ask questions with regard to this, and if you don't know what you have written, it's the end of that interview, you are out. Okay, so anything which you don't know, please don't mention it. Next is procedure performed. I just wanted to make sure over here, majority of nurses are making mistakes in procedure performed and procedure assisted. I'll just, you may be knowing it already, but I have seen lot of CVs, people make mistakes over here. In procedures performed, like for example, I will say the mistake. People used to write lumbar puncture, then ET tube insertion. Please keep it in mind that LP is you are not going to do. You are not privileged. You are only assisting. Endotracheal intubation, maybe there are in situations like those who are working in emergency department or ICUs, you may have the privilege. Okay, such people, please write it, because you are trained, qualified, competent enough to do the endotracheal intubation. Otherwise, all these are procedures assisted only, like central CVP insertion, you assisted, LP, you assisted, you have assisted for suture removal or suturing or wound dressing. Either you might have done it, or wound debridement, for example. It's not a nurse's responsibility, but wound dressing, of course, yes. And procedure performed, simply don't write that you have taken the temperature or vital signs. It's just basic. So you can write about medication administration, maybe all routes like IV, IM or subcutaneous, orally, whatever it is, and you can write intravenous cannulization, urinary catheterization. All these are like examples of these procedures performed. So while writing, please keep it in mind that don't change it, the procedure assisted and procedure performed. Next, equipment handled. Equipment handled also. I have seen lot of CVs that thermometer, sphygmomanometer. It's all are basic. No need to mention all these silly equipments in your CV. Even nowadays thermometer even small children will do, including the pulse oximetry, especially after corona everyone knows what is pulse oximetry. So all these are not at all a big equipment to showcase that you know how to manage it. Instead of that, you can say that okay, you managed, you know the infusion pump, you know syringe pump, you know how to operate defibrillator, you know how to manage a DVT prophylactic machine, cardiac monitor, and the ventilator. So you got lot of other equipments to write it over there. So write the specific one which really shows that that is a good for nurses. Okay. In-service education attended. Here you can write your in-service educations like 1 hour, 1 day, seminars, workshops, everything you can write it over here. And when you write it, please write the latest one always on the first. Here also you have to mention one, you have to remember one thing. You have to always maintain a consistency for your in-service education. Like for example, you have attended in-service education for 2 years. Next 3 years you haven't attended. Again you restarted it. If you can say some reason, maybe maternity leave, something like that, okay, it's agreeable. But otherwise, try to maintain consistency. Maybe at least in a year, 5 to 10 or 3. 3 is just minimum. 5 is ideal, 10 is super. If you have attended in a year, it really shows that your enthusiasm in learning and your employer will be happy enough to absorb you. And if you are writing BLS and ACLS, you have to be careful one more thing. If you are writing the year of passing, all these courses, there is an expiry. So wherever there is an expiry there, and if for example, if you have attended the BLS ACLS in 2020, and if you are keeping it, and now this is 2023, and it shows that the validity is only for 2 years and it already expired in 2022. If you keep it over here, again it doesn't show that it's not a good sign. Or you can say that still continuing and still valid, that you have to change your CV, then it looks good. One more thing, whenever you attend an in-service education, so try to make a small note of it and keep it in your personal diary or somewhere, all these notes, because there are lot of times the interviewer will ask questions pertaining to your in-service education. Maybe you attended 2 years before or 3 years before, and just the previous day of interview, you just write or read all these notes with regard to that particular day's training. And on the day of the training, the interview, if interview board someone asks, okay, you have attended a training on so and so, so what was all about it? And if you are able to say the answer, with their 2 hands, they will take you inside the institute and they will give you a job. So that is the beauty of in-service education. And if you are not able to say that, again, it doesn't make sense. Okay, next, going back to the personal details. Okay, personal details, here you can mention your address. So try to give your address for communication, and never ever give your passport details and all, because no one wants that. Even though it is required, they will ask separately your passport copy and all. No need to mention where it is issued, when is the expiry, all those things. Instead of that, you can write your address and age. Better not to write the age. Instead of that, you can write your date of birth. Why age is, suppose you have written your age, now it is 26 years. And maybe, and you will also write your date of birth also along with this. And maybe you may be submitting your CV maybe after 3 years. So by the time what happens is, your age is supposed to be 29 as per your date of birth. And still if it is 26, the person who is looking into your CV will understand that before 3 years you updated your CV. They don't want your CV, because all the institute will ask updated CV. So from you are giving an evidence for the interview board that the CV was updated 3 years before. You are out just because only of this. So you write date of birth, it will never change. It remains the same. And you can also mention, if you have driving license, you can mention if it is a 2-wheeler or 4-wheeler. 4-wheeler is always good, it's good. And if it is international license, that always valid. You can also write your hobbies. And when you write hobbies, please make sure that write hobbies only which you know. There may be certain people, they may write reading or listening to music, cooking, traveling, but Even the interview board asks some questions with regard to this, you should be able to answer to the question. Okay, so for example, if you are giving some cooking and they may ask Indian, Chinese or continental, if you say Indian, South Indian, North Indian, and you should be able to explain at least one dish. References, who is giving good reference about yourself, give the name of the references. Self-declaration, of course, you can give self-declaration. And place and date, not mandatory to keep a place and date, because again, same like age, if you keep the date and you may never change the date. And when someone asks for a vacancy and there is a CV, you will immediately send your CV to that particular person, and the date may be 2-year or 3-year or even 5-year-old. If any of such CV, more than 1 year gap with the present date, if it is dated and if it is coming to me, I will not look into how good the candidate is, I will reject the CV. I hope all the other reputed institute will do the same. So please make sure either you don't write the date, just ignore that part. Nothing is going to happen. But if you write the date, make sure that before it should be a date on the same day or the previous day of the CV when you are sending the CV to someone. If you are not keeping, doesn't matter, no one will know. And signature, again, nowadays everything is gone by email. So your email mail itself shows that it is signed by default. No need to keep a sign. So maybe you can just write your name, that's enough. No, if you are able to put a digital signature, okay, just put the digital signature, it's fine. So with this signature, I am also signing off. I hope that it was beneficial. Again, one more thing, don't follow this criteria which I had given as it is. You may have different opinion. I welcome all your opinion, but just a guideline for you to prepare. And you have one more option. If you wanted to download this particular template, it's in Word format. We will make it available for you in the video down to the video. You have an option to download, or if you have some queries with regard to this, you can contact the below mentioned number. I hope that you enjoyed the video and it was beneficial for you. Thank you very much for watching. Have a nice day.